and welcome to the St. Louis American Foundation's 20th Annual Salute to Excellence in Healthcare Awards. I'm Dr. Denise Hooks Anderson, Medical Accuracy Editor of the St. Louis American. The St. Louis American Foundation has hosted this event for the past 20 years to honor outstanding performance in healthcare in the African American community. Though the COVID-19 pandemic and the Black Lives Matter uprising have underscored disparities in our community, and that our healthcare workers are critical to our community, our health and wellness, and to our overall survival. Though this event has been a traditional, long-standing event for the Foundation, we now realize more than ever how critical it is for us to honor our healthcare heroes. It is my pleasure this evening to introduce our host, a veteran news anchor of KMOX Radio, the president of the Greater St. Louis Association of Black Journalists, and the fabulous Miss Carol Daniel. Take it away, Carol.
Thank you so much, Denise, and good evening, everyone. I'm Carol Daniel, and on behalf of the St. Louis American Foundation, we welcome you to the Salute to Excellence in Healthcare Awards. On this, the 20th anniversary of the Health Salute, we celebrate with special mindfulness of the sacrifices, the dedication, and the courage of our healthcare workers. For months now, they have been on the front lines of battling COVID-19. They're putting themselves in the path of this sometimes deadly virus in St. Louis and around the world in this unprecedented crisis. Our doctors, nurses, technicians, transporters, our EMTs, pharmacists, and everyone who supports patient care are rising to the occasion in caring for our most vulnerable population across the region. And in the communities where racial disparities in healthcare have never been more glaring, we salute you for your work. They deserve, you deserve our deepest respect and gratitude for your dedicated service. Community support and generous sponsors help us continue to carry out the mission of the Healthcare Salute, as well as enable the Foundation to provide scholarships for area students from the net proceeds of this event. The St. Louis American Foundation is especially appreciative of the support of its presenting sponsors. They are Centene Charitable Foundation and Home State Health. Our gold sponsor is Mercy. The silver sponsors are AARP St. Louis and A.T. Still University. Our bronze sponsors are St. Louis Children's Hospital and the Urban League of Metropolitan St. Louis. The sponsor of the Excellence in Mental Health Award is St. Louis County Children's Service Fund. And it wouldn't be a salute if we didn't have gifts. Our gift sponsor is Vincent's Jewelers, the official jeweler of the Salute to Excellence programs. Last year, the St. Louis American Foundation fostered $1.25 million in college scholarships to high-potential local African American students. Since its inception in 1994, the St. Louis American Foundation and its partners have invested $7.2 million in the St. Louis community. If you're watching tonight and you'd like to support the vital work of the Foundation and its investment in our students, let me say our babies, you can visit the address on your screen to pledge your support. Now, I'd like to introduce Keith Williamson, president of Centene Charitable Foundation, to greet you on behalf of our lead sponsors.
Good evening. I'd like to welcome you all on behalf of Centene Corporation and our Missouri Health Plan, Home State Health. We are honored to continue our support as lead sponsor of the Salute to Excellence in Healthcare Awards. At Centene, we're committed to transforming the health of our communities by providing high-quality, culturally sensitive healthcare services. We share the St. Louis American Foundation's belief in the importance of recognizing dedicated African American healthcare professionals for their exemplary performance and invaluable work. The challenges these professionals have faced in recent months in light of the pandemic make their achievements even more inspirational as they work to save lives and our hardest hit communities. We need more such heroes, and we salute the St. Louis American Foundation for recognizing and promoting interest in healthcare careers. To the awardees we honor today, we offer our warmest congratulations on your achievements and our sincerest thanks for your many years of dedicated service to our community.
Now let's begin the awards portion of our program by presenting the 2020 Excellence in Healthcare Awards, my favorite part. These awards are given to 8 individuals for their outstanding, even transformative work in their respective healthcare fields. We're delighted that they were able to come together as a cohort via Zoom, of course, recently to meet one another and to celebrate. They have our respect and our gratitude for all they do for their patients and for our communities. I'm going to introduce each recipient and tell you a bit about their work. The 2020 Excellence in Healthcare awardees are Kimberly Carter. Kimberly is the lead clinical documentation specialist with SSM Health St. Mary's Hospital. For 14 years, she's also volunteered as the Assistant Director of the Healthcare Ministry at Faith Miracle Temple Church. The ministry provides monthly health screenings, including glucose and cholesterol testing, blood pressure checks, educational seminars, and annual blood drives. Kim earned her RN and BSN from St. Louis University School of Nursing. And she worked in general surgery and transplant nursing before assuming her current role at SSM St. Mary's. Martin Gitanga. Martin began his career as a surgical technologist before returning to school for his nursing degree. With nearly a decade of experience in the neurosurgical unit, Martin is now a patient care manager at Barnes Jewish Hospital in the perioperative services department. He leads a team of talented nurses, surgical technologists, patient care techs, and unit coordinators in spine, neurosurgery, otolaryngology, and robotics. He also oversees the operations in hepatobiliary and gastroenterology. Martin holds a BSN from St. Louis University and a master's in healthcare administration from the University of Phoenix. Kimberly Hurst. Kimberly has served as a registered nurse for over 15 years. Her decision to pursue a career in nursing began when she was a single teenage mother who wanted to make a better life for her family. Kimberly followed her heart and attended Goldfarb School of Nursing at Barnes Jewish College and graduated with an associate's degree in nursing. Then she earned her BSN from Central Methodist University. She began her nursing career at Barnes Jewish Hospital, where she worked for over 16 years before transitioning to the VA Medical Center in St. Louis. She serves as RN care manager to bring compassionate care to our veterans. Tesh Jewell. Tesh has over 15 years of healthcare leadership experience in the St. Louis area. In her current role as Vice President of Operations for Adult Primary Care at Mercy Clinic East, she is responsible for all aspects of primary care operations and practices in Mercy Clinic's St. Louis division, ensuring financial performance, excellent clinical quality, and patient satisfaction. In the community, she serves on the North County Incorporated Regional Development Association Board and the Board of Directors for Integrated Health Network. Tesh holds a bachelor's in biology and a master's in health administration, both from Washington University. Helen V. Lane. In her 45 years of nursing, Helen has devoted her career to serving as a healthcare advocate for the North St. Louis community. She has held roles with Washington University Clinical Research Center, Barnes Jewish Home Infusion Program, and in behavioral health and drug rehab. Now, Helen works as a school nurse for St. Louis Public Schools, currently at Northwest High School, providing students with the care they need in school and connecting them with resources beyond the school campus to meet their needs. Dr. Leslie mccrary-etuk. A St. Louis native, Dr. Etuk's fascination with medicine began when she was just 5 years old. She graduated from St. Louis University and completed her residency training in family medicine at SUNY Downstate Health Sciences Center in Brooklyn, New York. She returned to St. Louis and joined Care STL Health, where she has served as Chief Medical Officer and a family medicine physician. Her practice focuses on patient education and empowerment around chronic conditions like asthma and heart disease, many of the same diseases that put patients at greater risk for COVID-19 today. Intasia Shaw. Intasia is the Emergency Preparedness Program Manager in the Communicable Disease Control Services Division with the St. Louis County Department of Public Health. She leads and manages a team of emergency response planners who develop disaster response policies and protocols and exercise plans in accordance with state and federal response guidelines regarding natural, man-made, chemical, nuclear, radiological, and hazardous materials incidents, as well as biological incidents like bioterrorism and infectious diseases. We can only imagine how busy she's been in 2020 as she plays a key role in our region's response to the pandemic. Tay holds a Bachelor of Science in Criminal Justice Administration and a Master of Science degree in Biosecurity and Disaster Preparedness, both from St. Louis University. And Tay is nationally and internationally certified in disaster preparedness and emergency management. David Swingler. As an 8th grader, David worked as a camp counselor at Matthews Dickey Boys and Girls Club, where he developed a robust interest in helping young people while still a young man himself. After attending Tennessee State University and receiving his bachelor's degree in psychology, David worked for the YMCA and the Boys and Girls Club of America before joining People's Community Action Corporation, where he now works as the Youth Service Director. Among many innovative programs he implemented, David began facilitating the school-based health center at Vashon High School, taking a leading role in helping students receive appropriate healthcare services, including primary care, mental and behavioral health, dental, health education, case management, and nutrition. All right, Excellence in Healthcare awardees, please give yourselves a big round of applause.
Congratulations.
Features of each of tonight's awardees can be found in the special commemorative edition of this week's St. Louis American. Be sure to pick up your copies when you shop or visit stlamerican.com, and do like I do, read it online. Our next award is the Dr. John M. Anderson Excellence in Mental Health Award. It is presented in partnership with the St. Louis County Children's Service Fund. I'll turn it over now to Emily Koenig, Acting Executive Director of the Children's Service Fund, to tell you more about this special memorial award.
Good evening. It's my pleasure to join you today. The St. Louis County Children's Service Fund is proud to continue its partnership with the St. Louis American Foundation to present the Dr. John M. Anderson Excellence in Mental Health Award, named in honor of the late Dr. Anderson. Dr. Anderson earned a bachelor's degree in chemistry at Colorado State University and came to St. Louis to train in microbiology at Homer G. Phillips Hospital. It was there that he discovered his passion for the field of psychiatry, and at the age of 38, he returned to school, enrolling at Meharry Medical College. After graduating from Meharry with honors, Dr. Anderson returned to St. Louis and completed his internship at Homer G. Phillips and his residency training at Washington University. He served the St. Louis area through his private practice, his work with professional medical organizations, and has left a legacy of tireless community service for nearly 30 years. The recipient of this year's Dr. John M. Anderson Excellence in Mental Health Award is Dr. Kanika Turner, a family medicine practice physician and the Associate Medical Director at Family Care Health Center. Throughout Dr. Turner's career, she has been passionate about destigmatizing treatment for addiction, especially in the Black community. At her clinic, she is a passionate advocate for integrating family health medicine, and addiction medicine. We're delighted to partner in presenting Dr. Turner with this award honoring Dr. Anderson's memory. Stay tuned to learn more about her outstanding work.
Dr. Kanika Turner is a St. Louis native and completed her undergraduate studies at St. Louis University, then continued to SLU School of Medicine and School of Public Health, where she graduated with dual degrees. As a family medicine physician at Family Care Health Center, Dr. Turner has made addiction medicine a special focus of her practice. When the COVID-19 pandemic hit St. Louis, it became clear to Dr. Turner that the COVID pandemic and the opioid epidemic intersect in a significant way. COVID-19 and overdose deaths both disproportionately impact the Black community. And if you look at the map of where the COVID cases are, it's very similar to the map for overdose deaths. Dr. Turner saw an opportunity to increase access to Narcan, a nasal spray used for treating an opioid overdose, as part of the mass effort to increase access to testing for COVID-19. She started with her own clinic and has since worked with others to get Narcan at their testing sites as well. It's an innovative program with the potential to make a measurable impact on opioid deaths in St. Louis. Let's hear more from Dr. Turner and see some of her impressive work.
I once had a patient who was actively using. She found out she was pregnant and came and sought care at Family Care Health Center. She was doing so well in treatment, and when I went to round on her in the hospital, I actually saw one of the notes, and it was so stigmatizing. Like, of course, the patient would have never saw this, but me, it like cut me to my heart to read this, because I'm like, this is someone who came into treatment, made her appointments, like doing awesome. And the picture that was painted as non-compliant with care. And I can only imagine what the encounter would have been with this person who wrote this note and talking to my patient who's doing well, maintaining her recovery. I love working at a healthcare center. I love being able to not turn people away because of your insurance status. You know, and for me, like forget that. The front desk will take care of that. Get them in my room. Let me see. And that's, you know, and that's how I am. We've had people to walk in, and I'm like, room, we'll get the consent. We'll get that. If I wouldn't have been a physician, a lot of these things I wouldn't have been exposed to. If I wouldn't have been on this side of medicine, maybe I wouldn't have been able to advocate for some of this. Sorry. And it's just, it matters to me so much just because I get it. I see the disparities, the inequities. I see how the healthcare system set this up. And because of that, the Black community is suffering on multiple areas, not just with opioids, but with diabetes, hypertension. You know, I was at one point in time, believe it or not, I was on food stamps before. And I never shared this. I was a single parent, I was going through school, I was only working part-time, and I felt so just belittled. And for me, it's like, I just need some support as I'm going through school. But I felt like it was a bad thing. There's so many different avenues, so many different areas that we need to intervene in our community. So I'm just a little passionate about that just because I see so much. And it just, you know, it's time for a change, and it's time for one now because people are dying. And once somebody dies, you don't get that second opportunity. I was 20 when I had my daughter, and I remember people were concerned, family members were concerned, was this gonna be a barrier for me? And, you know, one thing I can say, my parents, they definitely helped me. You know, my father, he's no longer with us, but my mom and my dad, they were there with me every step of the way. When I was on call, my dad was on call. You know, so, you know, patients share so much with you. And that's why I say it's so humbling, because what other career where people will open up and share that with me? And for me, you know, I'm in a position to where not only am I listening to you, but I also want to help you overcome whatever that is. And then also being able to really work in this area with addiction medicine and bringing attention and raising awareness to our community to transform the way we approach SUD care in the Black community, even in the Latinx community and LGBT, the Bosnian community, being able to transform that care. That's what really matters to me, and that's what drives me every day. I couldn't do it without the support of everyone. And when I say everyone, all different aspects. So definitely, in my clinic, Dr. Bob Massey. I will also, recognize NCADA. I mean, they're the ones who nominated me for this award, Alicia Smith. Well, I have to also say Dr. Rachel Winograd with UMSU MIMH and that entire team. With Dr. Fred Rotnick, my mom, my dad, even my church community, my pastors, and the community in general. And of course, my daughter, she's 14 now, and she's been there with me every step of the way. And I'm just so humbled to have that support network around me, because without that support network in place, there's no way I'll be able to fully do this work.
Congratulations again to Dr. Turner, our Dr. John M. Anderson Excellence in Mental Health Awardee. Our next category is the 2020 Health Advocacy Organization of the Year Award. This year's recipient is the Deaconess Foundation. In the spirit of its faith heritage, the mission of Deaconess Foundation is striving for the improved well-being and health of the people of St. Louis, with special emphasis on serving our children and most vulnerable communities. Accomplishing that mission takes the form of community investment and public policy advocacy in 4 key areas: healthcare, economic mobility, justice and racial equity, and early childhood education. And while 2020 has brought unprecedented new challenges in those areas, the team at Deaconess has risen to the challenge with a dynamic and innovative host of programs. Just months before the pandemic, the Deaconess Foundation was one of the primary funders in successfully wiping out $12.9 million in medical debt of families living at or below the poverty line through the RIP Medical Debt Program. Then, in April, Deaconess announced that it would award $2.2 million in grants to more than 50 Black-led organizations working in COVID-19 relief and recovery in the St. Louis region. And last month, Deaconess doubled down on its supportive advocacy organizations by announcing a cohort of 6 Black-led organizations identified as critical to recovery from COVID-19, and will invest another $350,000 in those organizations for the next 2 years to assure that they are well positioned to weather the economic storm that COVID-19 has created. Stay tuned to learn more about our Health Advocacy Organization of the Year and how the Deaconess Foundation is helping to shape our community.
Actually, when some of my boys were younger, there was this television show and they had the song. And they said, "This is the song that doesn't end, 'cause it goes on and on, my friend." Some people started singing it, not knowing what it was, and we'll continue singing it forever just because this is the song that 2020 feels like the week, the month, the year that doesn't end. And the first 6 months have been such that we've not known that there was something else that could be as dramatic, as powerful, as impacting as what we had just experienced, and we continue to have things to pile on. And so in as much as we began the year trying to do the work to make sure that we pull together the coalitions to expand Medicaid so we wouldn't be one of the 13 states in the union who haven't created that access to the healing touch for people in our community, and partnering with the United Church of Christ to do that, to partner with organizers at Jobs with Justice and Action St. Louis to do that. But then, of course, we're faced with a very real health crisis in March, and then we have to find ourselves sheltering in place. And then, of course, we began to wrestle again with the extrajudicial killing of Black people all over the United States of America, most typified in the 8 minutes and 46 seconds that many of us spent watching the very life being choked out of George Floyd. And so these have been the challenges that we've been called to make sure that we meet the moment. 2014, in the middle of the Ferguson uprising, what we saw was a conservative, philanthropic response, really driven by a lot of our corporate leaders in this community, who are generally very charitable and invest deeply in social service programs, making sure that delivery of training or education or after-school supports are there for our community. And this is really important. Quite frankly, though, one of the things we know is that the government is always going to be the lead payer when it comes to service programs. Indeed, philanthropy comes nowhere close to supporting those charitable efforts. So this time, our focus is to make sure that we're investing deeply enough in social change programs, organizing, advocacy, public policy change. Because when we invest there, we've come to know, based on studies by the National Committee for Responsive Philanthropy and others, that when you invest $1 in community engaged strategies and organizing and advocacy, you have the capacity to return $115 in government support, because the power of the people as organized and mobilized can change how the government allocates dollars. We have a remarkable example here. Over the course of the last 2 years of the Close the Workhouse campaign, we've seen an allocation of $16 million to an outdated, outmoded workhouse go down to $8 million in a 2-year campaign period. Now, that's not the closure that organizers are calling for, that organizers are rightly demanding, but it is a reallocation of resources that campaign was able to get done because it did public education, it did the direct legislative work, and it's mobilizing community and narrative. See, in April, we're able to partner with the Robert Wood Johnson Foundation to establish a $2.2 million fund specifically focused on investing in Black-led social service and social change organizations in the St. Louis region who are responding to COVID-19 and its impacts. Separately, launched in June, a $2 million racial healing fund for the St. Louis metropolitan region. And we launched that initially with 10 funding partners with Forward Through Ferguson. It will invest very specifically in healing individual and community trauma for organizers and activists, and invest in shifting the conditions that create that trauma. And that's a different response than deciding, as many did in 2014 and 15, that writing big checks to a couple of Black-led organizations that provide social services would get us out of this challenge. One thing I like to say to people about the year 2020 that many don't pay attention to, but it's critical for us at Deaconess, is that 2020 is the first year in American history where the majority of children under the age of 18 are children of color. So for our focus on child well-being, for our focus on civic commitment to children and youth, 2020 is absolutely critical, because it means that we have to center equity in all our conversations if we're talking about children. It means that we have to make sure we count every child in the census, because they will be the ones coming of age over the course of the next 10 years. And it means when we vote, we need to vote thinking about not just our children, but all children, and especially children of color. So our mission is more palpable, more important right now than ever before. And I'm counting on the next 6 months being as powerful as the first 6 months were challenging. Deaconess Foundation's board of Deaconess Center for Child Wellbeing, our staff, the volunteers who make this place and this mission work, are absolutely honored, excited, and delighted to be receiving the Salute to Excellence Health Advocacy Organization of the Year Award.
Congratulations again to the team at the Deaconess Foundation. And our next category is the Stellar Performer in Healthcare Award. This year's recipient is Dr. L.J. Punch. Dr. Punch loves to heal. Educated in medicine at the University of Connecticut and trained in surgery at the University of Maryland and the R. Adams Cowley Shock Trauma Center, this desire to heal has brought to life a career with a threefold focus: education, violence, and equity. As a trauma surgeon at Barnes Jewish Hospital and associate professor at Washington University's St. Louis School of Medicine, this work came to life in various undergraduate and graduate medical education courses that focus on the experience of violence-related injury across the entire spectrum of illness and healing. Through community engagement strategies and programs, Dr. Punch carries this mission forward each day, bridging the gap between the resources inside healthcare and the voices of the people. This includes a successful effort to bring the national Stop the Bleed campaign to members of the St. Louis community who are most at risk for violence and serious injury. It includes the creation of the T, a community trauma center that focuses on harm reduction as a mechanism for primary prevention. And as of this month, Dr. Punch will be moving the work outside the walls of the hospital and will be working full-time in community health to focus on 4 areas: bullets, COVID, homelessness, and opioids. Let's hear more about our 2020 stellar performer in healthcare and Dr. Punch's remarkable work in leading our community in the journey toward healing.
One of the things I did early on, just 6 months into my stay in St. Louis, was to be part of a community panel on gun violence that was hosted by A Better Family Life. After the panel, which I felt did not go particularly well from my standpoint because my white coat and long answers were not inspiring to anybody, James Clark came up to me and we spoke briefly, and I shared with him that I knew he knew my boss and our work, and he said, "Yeah, I know your boss. Where are you at?" And I thought, wow, well, how can I be present? How can I show up? Because I'm a trauma surgeon. We do our work inside the hospital. That is what we do. But then I was like, well, wait a minute. We have our own ability to be part of both helping the public be prepared and also prevent the impact of gun violence. Stop the Bleed is a national campaign that got launched after the tragic shooting in Sandy Hook Elementary in December 2012. And while it's wonderful and it's important, mass shootings represent less than 2% of all gun violence. And I was like, well, how can we take this well thought out approach and apply it to communities and lives where gun violence is not an if, it's a when. In the first year, we taught about 3,000 people, and since the program started, we've taught over 8,000 people and provided about as many trauma first aid kits along the way. We were able to launch our new face of our program, which went way past the initial Stop the Bleed and became affectionately known as the T. We had established an international trade to supply ourselves with our trauma first aid material. So in January, I knew something heavy was going on because all our suppliers were shut down. And I said, maybe we should shift gears because this is coming and it's a public problem that's going to spread along social lines. It'll be very similar to violence because it will take advantage of those who don't have what they need, and maybe we are in a position the same way we were to stop the bleed to now stop the virus. And now, many, many, many weeks later, I can't even count how many thousands of folks we've been able to reach in partnership with Prepare STL to stop the virus. So it's really powerful because it shows this very simple idea, which is if you are surrounded by bullets, if you're surrounded by a virus, if everyone around you doesn't have what they need in terms of their nutrition, if pain and trauma are the lived and breathed norm, right? It can seem as if the only choice you have is to succumb to it. We say, no. With the right training, with the right equipment, whether it's a tourniquet or a mask or a Narcan or a bandage, you have the power to change that outcome. You have the power to change that outcome. You don't need to wait for anybody else. So then what's next? So here I am. I say I'm a trauma surgeon in recovery. I have been there when many, many, many beautiful black men have taken their last breath. I've talked to mamas and papas, aunts and uncles about what has happened to their loved one too many times, and I have literally been covered in blood more times than you can imagine, all due to the impact of violence. And I have gotten to a point where I can no longer accept that fate for my people. Having seen the power people have, when you simply take the time to be present, teach, and give. I'm so compelled by both that strength and so disturbed by the horrors I've seen. I can no longer sit inside the walls of the hospital, and there is suffering just abounding everywhere around me. And so what I've decided to do is to move my office outside the walls of the hospital. And I will be full-time through the work of the T and Power for STL, be pursuing more and more and more what I'm calling community health. And so I'm going to be spending my time on 4 areas, and that will be COVID, bullets, homelessness, and opiates. And they all are areas where I find both profound resilience and tremendous suffering. One of the ways in which I hope to bring this philosophy of health and well-being being married is in the creation of a new health experience, which I'm calling the BRIC, the Bullet-Related Injury Clinic. This clinic is getting set up to serve the needs of people who experience a bullet injury and are discharged from the emergency department after having been shot. Frequently, their wounds are superficial enough that they don't require surgery, but they're deep enough that they still completely disrupt the person's well-being. Amazingly, the coronavirus pandemic has facilitated the growth of this idea because telehealth and the obstacles to telehealth have gone down. And so we'll be using physical presence, telehealth, and hopefully even mobile health to be able to reach people where they are after bullet-related injury. I'm so excited about this because I believe it is the untreated trauma from decades ago that's expressing itself now in all the folks that we see involved in violence. If we want a different future, we have to take care of what's happening right now. And I think we're allowing way too many people to heal on their own without what they need. I want to give them the knowledge and resources to be well, to truly be well, after experiencing a bullet-related injury. So the BRIC is hopefully going to be launching later this summer. I've actually stepped down from my position at Washington University so I can do this work and work like it full-time. I'm so totally dedicated to the idea that we must practice medicine beyond the walls of the hospital. I am truly grateful to the St. Louis American and the Foundation for having a heart for the education of our youth. I certainly am where I am because people took the time to teach me, and I had the mechanism and resource to learn along the way. And I don't really think there is anything more important than that. And so hats off to the American for doing this work. Hats off to Rebecca Rivas and the incredible reporting that she has done along the way, bringing light and truth throughout our city. And hats off to everyone who is doing their best to live their authentic truth and working toward their own healing.
So very inspiring. Thank you again, Dr. Punch. Our final award is the Lifetime Achiever in Healthcare. This year we honor Rosetta Keaton, Director of Patient Access at the St. Louis Regional Health Commission. Rosetta has been a tireless patient advocate and ombudsman in the medical community in St. Louis for more than 30 years. Prior to joining the Regional Health Commission in 2013, she served as the Community Service Manager at St. Louis Connect Care and managed the General Relief Program for the City of St. Louis. In her current role, Rosetta is responsible for connecting with safety net patients to ensure access to quality health care. With empathy and responsiveness to the frustrations of patients as they navigated the St. Louis healthcare safety net, Rosetta developed a host of programs to help bridge the gap of needed patient services. Among these, Rosetta established a new member orientation to educate patients on their benefits within the Gateway to Better Health program. She also proposed the formation of a patient advisory board. And her recruitment efforts resulted in more than 15 patients who have been actively engaged in the work of the RHC by providing their voice as the organization works to improve the way individuals access healthcare services. She secured grant funding to work with residents living in St. Louis zip codes at high risk for chronic diseases to increase health literacy and help them become active participants in their own health care. And outside the office, Rosetta is the founder and facilitator of Sister Connection. It's one of the oldest local breast cancer support groups. Stay tuned to learn more about Rosetta Keaton and her passionate, lifelong service in healthcare.
I grew up in St. Louis in a very poor household. My dad worked 3 jobs to take care of us. He didn't have insurance. And I remember he was a patient at Homer Phillips Hospital, and some doctors taught him how to care for himself because he would have to take off from work to go to doctor's appointments. But he worked these 3 jobs as long as I can remember, taking care of us and telling us that we were somebody and that we could make it and we could do things. I remember going in the emergency room once and Daddy needing to sit in the wheelchair and be rolled in. And the nurse is saying, "Hi, Mr. Johnson, how are you?" Instead of, "Oh, he's here again." People were very kind to him though. But he was in a system of people who looked like him, who understood him, who knew the plight of this man trying to take care of his wife and 5 children. And then for me to see my people go into systems where people didn't understand them, who didn't understand their plights, I guess that's where it came from. When Homer Phillips Hospital closed, a part of the Black world in St. Louis died. A part of who we were was just ripped away from us. And I guess as I'm talking to you, I realized that healthcare has been a more part of my life than I actually knew. And I've never left the people that I've always known, the people who were uninsured and underinsured, my community of people. I have been a patient advocate in St. Louis for more than 35 years. I don't even think of what I do as work, because I'm just living an extension of who I've always been. And with my personality and rebelliousness and whatever else I have that make me want to fight, this is an extension of my fighting. So it doesn't feel like accomplishing. It feels like doing what you're supposed to do. And I got to make a living doing it, I guess.
It is my pleasure to introduce our 2020 Lifetime Achiever in Healthcare, Rosetta Keaton.
I cannot tell you how excited I am or how happy I am to receive this prestigious award that comes from a newspaper that represents the community that I serve. Getting the award is sort of like God kissing me on my cheek and telling me, you did a good job, girl, especially during this time of my life when I am just getting ready to retire. I'm in preparation for it right now, and I will be retiring the end of 2020. So I want to say thanks to those people that have helped me and supported me and sometimes even saved my behind. I want to thank my mentor for the Homer Phillips and City Time, who taught me that there's two sides to every story. There's somebody's side and then there's the truth. And it's up to you to figure out where the truth lies. I've tried to live by that, and that was Jackie Jackson. I also want to thank my St. Louis Regional family and Connect Care family, who were the next people along my journey. I love my Black community and I love serving them. And they have been my inspiration, along with my daddy, to do the things that I have done that everybody gives me credit for that I just don't even remember. I really want to also thank my new family, St. Louis Regional Health Commission. And so, before I close, I want to say this about the fight. Back in the day, I would fight. And I didn't know why I was fighting. I didn't know what I was fighting because it didn't have a name. I just knew that it wasn't right and that my community wasn't right. And nobody was treating us in healthcare the way that we should be treated. Remember, I said it didn't have a name. But today, in 2020, there are several names. It has a name. And I'm going to offer these names to the people who I'm turning the fight over to. Fight for justice. Fight institutional racism. Fight inequities. Fight toxic stress and trauma. We know the names now. And whenever you see them, Dr. Punch, whenever you see them, Dr. Turner, Bethany, Angela, Gail, and all of my other friends and adopted children, fight for them. Fight for our people, Rhonda, my daughter. Fight for our people. Make sure that you make sure that when there's an injustice or there's a healthcare inequity that they're not getting, that you're there. And I can go home and I can sit down, cross my legs, read a book, and be happy. Again, thank you, St. Louis American. Thank you, St. Louis American Foundation. And most of all, thank you, community, for putting up with me, allowing me to be your mouthpiece when it was necessary, your friend when it was necessary. I've enjoyed the fight. I'm not done yet because I'm not dead. So I'll continue fighting, but I'll fight in a different way. God bless you all, and thank you again.
Our warmest congratulations and sincere thanks again to all of our inspiring awardees. We say it every year. There are so many in our community that are serving us. You inspire us. Keep doing it. We are here for whatever you need. Before we sign off, I want to remind you that everyone who registered for the program tonight has been entered into, yes, our attendance prize drawing. It includes a grand prize of $1,000 cash, okay? The winners will be announced in next week's edition of the St. Louis American. So another reason for you to pick up your copy or to check it out online. If your name is chosen, the American will reach out to you at the registration contact that you provided to make arrangements for you to receive your gift. Thank you so much, ladies and gentlemen, for joining us tonight. If you felt inspired by tonight's celebration, I always am. You can pledge your support for the work of the St. Louis American Foundation by visiting the web address on your screen. Good night. Take care of each other. Be well. We'll see you next year.